I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida with the Whitford Thomas Group, speaking to you today about definition of major depressive disorder. When we talk about major depressive disorder, it's what we would consider an exaggerated depression. The difference between a major depression or a major depressive disorder and, let's say, a dysthymia or a normal depression would be that it tends to be shorter in duration. So the onset of the symptoms usually within two weeks of something occurring, and then it lasts up to about 6 months. Major depressive disorder tends to have all the symptoms in the other depression, although with major depressive disorder, what oftentimes occurs is the person has the inability or difficulty in doing normal activities. So individuals who are experiencing major depressive disorder tend to kind of do away with going to work, socializing with friends, paying bills, interacting with loved ones. And that's probably the difference, the primary difference between a depression and a major depression or a major depressive disorder is that oftentimes with depressions, people still function, they still go to work, they still interact, their mood is significantly affected. With a major depressive disorder, you have those same symptoms, but the person finds it very difficult to actually continue on with normal life activities. Major depressive disorder oftentimes requires a medication to rid yourself of the disorder, but the counseling is still an important piece of that because with all depression, be it major or otherwise, there's a thinking component. So we certainly want to look at changing our thinking in order to rid ourselves or minimize the depression, but oftentimes medication is important here. I'm Dr. David Thomas, speaking to you today about major depressive disorder.